Hi everyone, Josh Free here. If you follow me on LinkedIn, you've probably seen me right here talking about pharmacy stuff, 340B program, other topics. But I'm here today to talk about something new, which is my new company, RxFusion. And we specialize in helping physician practices dispense meds directly to their patients through what's known as physician office dispensing. And one of the first questions I get asked is exactly what is that and what are the limits and what can you and can you not do in terms of physician office dispensing. And so it's pretty self-explanatory in a way. It is physicians directly dispensing to their own patients. And this in most states can include nurse practitioners and physician assistants, as well as other providers with prescriptive authority. It sometimes gets framed as being sort of a pharmacy without a pharmacist, but I don't look at it that way at all. In most states, dispensing to your patients falls under the practice of medicine. But there are a few exceptions. There are some states where you can't do this. But largely, it falls under the practice of medicine, similarly to how a physician or a medical practice can administer drugs directly to their patients. In most cases, you can also dispense drugs directly to your patients. Now, as a pharmacist, I would tell you there are things that should go to the pharmacy. Office dispensing isn't meant to cover everything, but it's a great way for patients to get started on their therapy, for the physician to ensure that critical medications get started right away. And it also keeps the doctor a little bit more in the loop in terms of what's going on with the patient, making sure that the patient didn't have some sort of barrier, prior authorization, or the pharmacy was out of stock, or some other sort of issue that's preventing or delaying therapy. It can dramatically improve medication adherence. Some studies say 20 to 30% of prescriptions get abandoned. Office dispensing is one way to minimize that. It's convenient for the patient and is a great patient satisfier. So for clinics looking to enhance the patient experience with no extra trip to the pharmacy, no wait times, transportation barriers, all those sorts of things, office dispensing is one way to solve a problem. In the case of clinics that are serving an indigent population or perhaps people without transportation, et cetera, this can be a real barrier. So office dispensing is one way to help those patients. Additionally, this can be a revenue stream for the practice. And that's something that I'll talk about in a subsequent post. But short story is medical practices can build a pharmacy benefit if you have the systems and software to do so. And that's exactly what we specialize in at RxFusion. Lots more content to come. Really excited about this new venture, and you'll hear more from me soon about RxFusion. In the meantime, check us out, www.rxfusion.com, or if you have questions, you're interested in learning more, message me here or check out the links on the website.